There are numerous types of injuries and illnesses that exist and that can occur in the athletic environment. An athlete can experience an injury or overcome by an illness that can be minor or very disabling to their performance and their livelihood. In this first part of Chapter 2, we are going to look at mechanisms, the healing process, what a sign versus symptom is, and what acute versus chronic types of injuries are. When we look at mechanisms of injury, a mechanism of injury is the cause of the injury or the manner in which the injury occurs. So when we ask someone, what is the mechanism, we are really asking them, hey, how did that injury occur? Common mechanisms for soft tissue and bony injuries include compression, separation, and shear forces. When we look at compression, we can see at the figure on the right-hand side, compression forces occur when the tissue is crushed in between two or more objects. Maybe this is when her foot is compressed between the weight and the floor, or that when somebody else falls on another person's extremity. Separation occurs, or tissue separation occurs, through tension. This is known as a tension force. This occurs when a structure is pulled apart from either one of both ends. The tissue is stretched beyond the anatomical limit of that tissue, and it results in a tissue being torn. This could be, for example, when an athlete twists their ankle or stretches a muscle. Lastly, shear forces are applied to the body when one or more forces move across the tissues. If more than one shear force crosses the tissues, the forces typically move in opposite directions. When this occurs, it can cause a twisting motion as the body part moves or the tissues move in opposite directions. We also have to be aware of the extent or degree of injury. The extent or degree of injury is determined by the severity and intensity with which the force is applied. It is also determined by the size of the affected area. Most likely, a more severe injury if a great amount of force or stress is applied over a small area versus a larger area. In addition, speed of force can also determine the severity of an injury. The greater the speed during impact, the greater potential for a severe injury. Let's move on to the healing process. After an injury occurs, the healing process begins. The healing process is imperative for an injured or ill athlete. This is a process by the means to repair the tissues, return the body back to its uninjured state or as close to as possible, and restore the body's equilibrium. This begins, like I said, right after an injury occurs. It is imperative for that person to go through this process. There are 3 phases of the healing process. This includes the inflammatory phase, the fibroblastic repair phase, and the maturation remodeling phase. These 3 phases, as the diagram at the bottom of the slide shows, are on a continuum. The completion of each of these phases, starting from the left-hand side of the inflammatory phase to the right-hand side of maturation remodeling phase, the completion of each of these is imperative for the tissue to heal properly and for the person to then continue on with the healing process. Let's look at these in a little bit more depth. The inflammatory phase. This is the first phase of the healing process for acute injuries. It begins at the time of injury and can take up to 4 days to complete. Typically, this concludes around 2 to 3 days. When a tissue is damaged, immediately after its damage, vasoconstriction occurs. After vasoconstriction, vasodilation occurs. Let's go back to vasoconstriction. Vasoconstriction is when the cells or the arteries squeeze or veins squeeze together. They constrict or do not allow blood flow. However, after this occurs, vasodilation or the opening of these begins to occur. This is what occurs and causes swelling in the area. In addition, at the same time, there are various chemical mediators that are released to help the inflammatory process. This includes histamine and bradykinin. These are released to help along with the inflammatory process. Part of this inflammatory process, when we see an inflammation or an increased vasodilation and these chemical mediators, we see that the area becomes red, painful, there's an increased tissue temperature, the blood vessel permeability changes, there's more permeability, so there's more bleeding in the area, and there's additional swelling due to exudate. Exudate is formed by plasma fluid and cells. It is located in the space outside of the blood vessels. This exudate just sits there because it cannot be circulated through the body. In addition, other chemical mediators are released to help make the exudate less viscous. This is less sticky. It makes venous return possible, so we get the swelling out of the area, impedes inflammation, so we stop inflammation, and decreases the amount of swelling. At the end of this phase, phagocytosis occurs. This is when phagocytes debride the area. In addition, platelets create a plug that helps limit the size of the inflamed area so bleeding and injury does not continue to occur. There's also a material called thromboplastin that is released from the cells in the area, which creates that clot or that plug in the area. This is what we typically see on the outside, or what we refer to as a scar, and this is what helps clot and stop the bleeding from occurring, which helps limit the injury. The next phase is the fibroblastic repair phase. The fibroblastic repair phase has a longer duration than the inflammatory phase and can take up to 6 weeks to complete. This is characterized by a decrease in the signs and symptoms of inflammation, that redness, the pain, the swelling, a continuation of phagocytic activity, fibroblastic activity, which is the building up and breaking down of the tissues to form new tissues, and the formation of collagen tissue, and a scar. So this scar occurs after that plug is formed and that area is clotted. In addition, capillaries in the area that are formed within the injury or the healing process bring oxygen to the area. This oxygen helps to heal the tissues. Along with more oxygen, the area continues to be debrided and the debris in the area continues to be decreased. Therefore, pressure, pain, and swelling is also decreased, and it allows for an increased range of motion in the area. Lastly, in this fibroblastic repair phase, fibroblasts create a loose meshwork of unorganized collagen at the site. This creates that scar, or what we would refer to as a scar on the outside. As this process occurs over the 6 weeks, this collagen reforms and strengthens over that time period. The last phase of the healing process is the maturation remodeling phase. This is the longest phase of the healing process. It usually begins around 3 weeks post-injury and can take years, or at least up to a year, to complete. In this phase, organization of the collagen scar tissue occurs in the beginning of this phase, and as this phase continues, we apply stress to the area, and these fibers strengthen. And as these fibers strengthen, tissue is replaced at the area, and the scar continues to decrease in size. If you think about it, if we have an injury to the outside of our skin, throughout time, that scar hardens, and that tissue underneath becomes stronger. As that tissue becomes stronger, the scar or the outside crust starts to fall off because the underneath tissue is becoming stronger. So that scar on the outside decreases in size. However, if too much stress occurs, the scar can be disrupted and the healing process is prolonged. This process is prolonged because then the scar or the injured body part has to replug and then continue on with the healing process again. Think about it this way. If we do have that injury to the skin and we break open that scar, it takes that much longer to then plug or stop the bleeding for then the area to clot and to scar over again to heal properly. Let's move on to some other terms that we need to differentiate between. First and foremost is the idea of bone versus soft tissue healing. Even though we're within the healing process still, we need to understand the differences between the two. When we look at this, bone and soft tissue have a very similar process in the inflammatory phase. The big difference occurs in the maturation phase as well as the second phase of the process, which is the fibroblastic repair phase. When we look at these phases, in the fibroblastic repair phase of a bone, osteoblasts instead of fibroblasts are formed, and these form a callus at the injured site. You can see here in the picture where the arrow is pointing that there is a circular shaded area around the fracture. There was a fracture in between here, but over time, with the fibroblastic repair phase into the maturation remodeling phase, we know that there is a osteoblast or forming callus. When we go into maturation remodeling phase, the bony callus becomes hard and strong and acts like bone would initially. Couple other terms that we need to be aware of is what a sign is compared to what a symptom is. These are very different and often confused in students. A sign is of an injury are physically observable and objective. Typical signs are differences in tissue temperature. We can actually feel that. Asymmetry, we can actually see that. Swelling, we can see that. Deformity, something that doesn't look the same from one side to the other. Redness and loss of function. Those are all very observable that we can see with our eyes. This is different than what a symptom is. Symptoms of injury are not physically observable, but are subjective to the injured patient. Common symptoms are pain, soreness, someone complaining of being nauseous, maybe having a headache. Those are things that we cannot observe or that we cannot objectively see or measure from the outside. Lastly, let's look at what an acute injury is compared to what a chronic injury is. Acute injury occurs when the body is suddenly afflicted by trauma or damage to its tissues. This typically occurs when an athlete can identify the mechanism of injury or how it occurred. When this does occur, the inflammatory process is initiated immediately after the injury. This is compared to a chronic injury where athletes often cannot identify a specific sudden mechanism of injury. When you ask them, hey, what happened there, they don't know what has happened because it's happened over a long period of time. These signs and symptoms that are associated with chronic injury develop more slowly than with acute injuries, and they are very long in nature. So within a chronic injury, it doesn't just start with the inflammatory process. It can fluctuate between the inflammatory and fibroblastic repair phases throughout this chronic injury as that body area is stressed or not stressed. An acute injury that is not treated appropriately may not heal properly and can become chronic. Sometimes we see these injuries become chronic and they can fluctuate, like I said, between these inflammatory and fibroblastic repair phases because they are not treated correctly.